You want to smell good and be clean from head to toe with an emphasis on the feet and toes today. I'm going to show you how to have the cleanest, most beautiful, smoothest feet as a derm PA. If you have crusty and cracked heels, pedicures can help, but you can do this at home as well. Get one of these foot scrubbers off Amazon or any bucket, fill it with warm water and soak for 10 minutes. Once everything is nice and soft, you want to get a foot scrubber. This one is from Cheeky Glow. It's glass, non-porous, so it's easy to clean, not going to trap bacteria, and last a long time. Use this to scrub the heels. Because you've soaked for 10 minutes, everything should come off pretty easily. You don't want to scrub too hard and cause any bleeding. If you're doing this for the first time, not everything's going to come off, and that's fine. This is going to take several treatments, but trust me, it works. After scrubbing, you want to hydrate the feet. You can use a healing ointment from CeraVe, or you can use a heel balm. I got one from Japan, but you can use the Aquaphor balm stick as well. That would work too. If you have warts on the feet, toenail fungus, or foot fungus, which is known as athlete's foot, you can also treat this at home as well. If you have itchy, inflamed, cracked, red feet, you might have some athlete's foot. You can get some clotrimazole over the counter. Use this twice a day for 2 to 4 weeks. See if that helps. If it doesn't, go to a derm, but I would try this first. Athlete's foot is super common. A good way to prevent this is using Nizoral shampoo as a foot wash, really getting in between your toes. I would do this a couple times a week. If you have thick, brittle, yellow nails, you might have some toenail fungus. If it's mild, you can treat at home with some over-the-counter treatments. However, the most important thing that I always tell my patients is to have 2 separate nail clippers. Nail fungus is contagious, so you want a separate one for your infected nails and a clean one for everything else. That way you're not transferring it from toe to toe or toe to fingers. Also want to keep your toenails relatively short. There's no reason for them to be long. The best length is really the length of the flesh of your toenail. That way you're not trapping dirt and bacteria that causes odor underneath. If you have plantar warts, treat them sooner than later. I have so many patients who just ignore them for months and months, and they just get bigger and spread. They have over-the-counter wart stickers or creams that can be helpful, especially if you catch your warts early. However, if you've waited a long time, you might need to go visit your derm. I hope that was helpful. Let me know if you have any other questions.